So we're going to go ahead and continue with our second part of our blood vessel lecture. This is again lecture 7, and we're going to pick up with a little fun little activity, which is checking circulation. So table 21.3 goes through all of our different pulse points. So feel free for a few minutes to pause this lecture, have some fun, feel for some of these structures. You can palpate these and use the location to help you identify where these pulse points are. Now you should be familiar with some of them, right? You've seen a lot of people put their fingers on the common carotid artery. Again, look at its location to the side of the larynx or the voice box. We've seen the radial artery, that lateral aspect of the wrist on the thumb side, the two fingers there. Again, you could try your femoral artery, your superficial temporal artery. This is a good one. Facial artery, brachial artery, dorsal artery of the foot, popliteal artery behind the knee. So again, good places to take a break, take a few moments and try to see if you can locate these pulse points and take your pulse rate. Remember, stand by a clock or a timer, count for 30 seconds, multiply it by 2, and you have your heart rate. Checking circulation. So we can check circulation by measuring blood pressure. Now we're measuring systemic blood pressure specifically at the brachial artery. We're measuring these terms we've seen before, systolic blood pressure over diastolic blood pressure. So basically what we do is we take a blood pressure cuff, sphygmomanometer, and we're going to inflate that to 140 millimeters of mercury. And if people with hypertension, we might want to inflate that to 160 or 180. We're then going to slowly release the cuff, and the stethoscope is going to be in the crease of the elbow. We're listening for the sounds of karate cough. Now, classically, there are 4 sounds, but we're going to work through 2 sounds. The first sound is the pressure that the ventricle exerts onto that brachial artery to reestablish blood flow. It will sound like a little pop. This is your systolic pressure. Then you're going to hear as that slow beating sound gets softer and softer, then disappears. This will be our diastolic pressure, our second sound of karate cough. That will give us a full blood pressure reading. Again, based on this reading, we were 120. So we'll write it in red. 120 over 80. And this again is a typically normal blood pressure reading for a healthy individual. Shock and homeostasis. Shock is an inadequate cardiac output that results in failure of the cardiovascular system to meet the metabolic demands of the body's cells. Now, cell membranes dysfunction, cell metabolism is abnormal, and cell death can occur. There are various types of shock. The first is hypovolemic. Now, this relates to blood and the fluid compartments. This is a low blood volume is typically what's happening here. This is typically a disruptive shock that relates to the cardiovascular system, or the vascular system. We then have cardiogenic shock, and this primarily arises from cardiac dysfunction, so the heart's inability to pump blood. Next is vascular shock. So vascular shock is a disruption of blood flow to the tissues and not enough oxygenation. Now, the last types of shock is obstructive shock, and this is caused by the inability to produce adequate cardiac output despite normal intravascular volume and or myocardial function. So there are several examples of this. Some clinical examples could include things like acute pericardial tamponade, tension pneumothorax, pulmonary or systemic hypertension, and even congenital or acquired outflow obstruction. So these are all pretty good examples of obstructive shock. So how does the body respond to shock and allow us to return back to homeostasis? So we see the activation of the renin-angiotensin-aldosterone system. We're going to secrete antidiuretic hormone, all with the goal of increasing blood volume, increasing blood pressure. We can activate the sympathetic division of the autonomic nervous system. Again, fight or flight, adrenaline. And we can release some local vasodilators. These vasodilators help open up, kind of like how nitric oxide is going to help open up blood vessels, allowing for an easier flow of blood through possibly an already occluded artery. Let's use a flow chart to show how the body responds to hypovolemic shock. So again, low blood volume. So there's the disruption, low blood volume. We're ultimately lowering blood pressure as well. The baroreceptors in the kidney and the JGA, the juxtaglomerular apparatus, and the baroreceptors in the carotid sinus and arch of the aorta are detecting this decrease in blood volume and blood pressure. Their input is going to be to increase secretion of renin and decrease the rate of nerve impulses. We're talking now to the liver and the lungs. This is the renin-angiotensin-aldosterone system. We're talking to the control center, the hypothalamus and the posterior pituitary to secrete antidiuretic hormone, and the cardiovascular centers in the medulla oblongata. Now that medulla oblongata is going to increase sympathetic stimulation and hormones from the adrenal medulla. So here's our adrenaline, our fight or flight. We're talking to the blood vessels to constrict those blood vessels. The ACE from the lungs, angiotensin converting enzyme with angiotensin, is going to be working to affect an action on the adrenal cortex to liberate aldosterone, which in turn is going to talk to the kidneys, as is antidiuretic hormone, talking to the kidneys to conserve salt and water. By conserving salt and water, we're increasing blood volume, increasing systemic vascular resistance, increasing blood pressure, and returning to homeostasis. Blood vessels constrict again, increasing SVR. Heart rate and contractility increase, increasing blood pressure, again bringing our body back to a homeostatic condition. Now, when a person does enter into shock, what are some signs and symptoms? Again, let's have a little fun with looking at some clinical connections. We see that some signs include clammy, cool, or pale skin, tachycardia, which is a heart rate over 100 beats per minute, so a rapid heart rate. We can either see a weak and rapid pulse, profuse sweating, hypotension, which is also low blood pressure with a systolic blood pressure less than 90 millimeters of mercury, altered mental status, confusion, dizziness, decreased urinary output, thirst, and acidosis. We can look at a few more clinical examples, like a brain aneurysm. So again, remember those elastic arteries. The more you abuse them, you exert too high a pressure on them. They're like those hairpins. That's that analogy we used in our previous lecture. And this is what happens. It starts ballooning and ballooning and ballooning until it can't take anymore and it ruptures. And you get a bleed on the brain. Here is another example of an aneurysm, yet this is an aortic aneurysm. Similar scenario. If our aneurysms are going to occur on the aorta, they typically tend to occur on the abdominal aorta, again, where pressure tends to be the highest, and even on that aortic arch. Atherosclerosis. This is America's #1 killer. This plaque buildup from bad diets, fast food diets. So we can see from the pictures over time, the lumen of the artery is getting smaller and smaller as we build up all this plaquey material, right? And this is bad because when stressed, even under sympathetic fight or flight, where these arteries and arterioles are going to constrict again, that already occluded lumen could either close down completely and cause death or problems. Now, we can see in this picture right here, look at the blood flow. It is, I don't even think, we're going to zoom on in so I can actually show you in red how tiny that blood flow is. So through that artery, only this amount of blood, that little bit. This should be a normal opening to that artery. That's how much blood should be flowing. But because it's so occluded, we're diminishing blood flow. Now, how do we go in there? We go in with a stent, and you can actually see the meshy cross-hatching in that stent that is opening up that artery again to reestablish normal blood flow. So atherosclerotic plaque. So this pretty much concludes our material for our blood vessel lecture. The following PowerPoint slides will not be covered in lecture. This material will be tested in laboratory and on the final lecture exam, but not the lecture test. So use your list of arteries, veins, and special circulations that was posted in Blackboard as your word bank, your study list, and use the following slides to help you identify them, find them. You can use these to make note cards and test banks and study sheets. So review these on your own time. Again, will not be tested in lecture, only in lab.